Are you over 60? Does it feel like your entire day, and worse, your entire night, is being planned around the location of the nearest bathroom? That feeling of sitting down to watch a movie, only to have to get up again 45 minutes later. That nagging anxiety on a car trip, and that deep, bone-weary fatigue from being woken up 2, 3, or even 4 times a night. If this sounds familiar, I want you to listen very closely. This isn't just an inconvenience. It's not simply a normal part of getting older that you have to accept. It is a critical and often urgent message from your body. Specifically, it can be a warning shot from your kidneys, the silent, hard-working gatekeepers of your health. My name is Dr. Robert Clark. For over 30 years, I've had the privilege of helping thousands of patients navigate their health in their 60s, 70s, and beyond. And one of the most common and most commonly dismissed symptoms I see is this exact issue: a sudden increase in urinary frequency and urgency. You're not alone in this, not by a long shot. But the mistake so many people make is to write it off. They're embarrassed or they feel it's inevitable. But ignoring this signal can mean missing the early signs of manageable and sometimes serious health conditions. What we doctors call nocturia, the need to wake up frequently at night to urinate, is more than just a sleep disruptor. It's a vital clue. So today, we're going to have a frank and honest conversation. We will pull back the curtain on why this is happening. We will explore the deep and intricate connection between your bladder and your kidneys. We'll talk about how very common, life-saving medications might be contributing to the problem. We will clearly define the absolute red flags that mean you need to call your doctor today. And most importantly, I will give you practical, actionable steps you can start taking right now to regain control, improve your sleep, and safeguard your long-term health. Think of this not as a lecture, but as the beginning of a crucial conversation your body has been trying to have with you. Let's start by understanding what's happening on the inside. Let me tell you about George. George is a 68-year-old retired history teacher who came to see me a few months ago. He was exhausted. "Dr. Clark," he said, "I feel like I'm a zombie. I haven't slept a full night in over a year. I'm up every 2 hours like clockwork." He'd chalked it up to his age and his 1 cup of coffee in the morning. He'd accepted this new, exhausting reality, but his wife finally urged him to come in. George's story is incredibly common, and it highlights why we need to look deeper. The first thing we need to understand is the natural aging process of our kidneys. Imagine your kidneys are a pair of incredibly sophisticated, high-tech water filters for your body. When you're young, you have about 1 million tiny filtering units, called nephrons, in each kidney. They are working at peak performance, diligently cleaning your blood of waste products, balancing your electrolytes, and managing your body's fluid levels with incredible efficiency. As we journey past 50 and into our 60s and 70s, the number of these active filtering units can gradually decrease. The remaining nephrons have to work harder, and their ability to concentrate urine can become less effective. Think of it like a coffee filter that's become a bit thinner over years of use. More water passes through more quickly. Your body can't hold onto fluid as efficiently, so your bladder fills up faster, sending you that all too familiar signal to go. This is a normal physiological change, but it's only one part of a much larger puzzle. Have you ever stopped to wonder why this seems to get so much worse at night? That question, "Why does it get so much worse at night?" is one I hear almost every day in my practice. The answer is fascinating, and it involves a powerful hormone you've likely never heard of called antidiuretic hormone, or ADH. Think of ADH as your body's internal water conservation manager. During the day, your body produces less of it, allowing your kidneys to flush out excess fluids as you stay hydrated. But at night, your brain is supposed to release a surge of ADH. This is a brilliant, evolutionary design. The hormone travels to your kidneys and gives them a clear signal. "Okay, team, it's time to rest. Slow down urine production, concentrate what you do make, and let this person sleep." This is precisely why a healthy person can sleep for 6, 7, or even 8 hours without being woken by their bladder. But here's the crucial part: as we get older, this beautifully orchestrated hormonal rhythm can start to falter. The brain might not release as much ADH at night, or the kidneys themselves can become less responsive to the hormone's signal. Essentially, the nighttime manager isn't showing up for their shift, or the workers on the floor aren't listening. The result is that your kidneys don't get the memo to slow down. They continue producing dilute urine at a daytime rate, even while you're fast asleep. Your bladder, which has a finite capacity, fills up far more quickly than it should, sounding the alarm and forcing you out of bed, not once, but multiple times. For my patient George, this was a huge part of his problem. When we looked at his lab results, we could see the evidence of this pattern. It wasn't just in his head, and it wasn't just old age. It was a specific, identifiable physiological change. Understanding this hormonal shift is a game changer because it transforms the problem from a vague annoyance into a concrete medical issue we can address. But it's rarely the only factor at play. Very often, something else is compounding the problem, acting as an accelerant on an already smoldering fire. And that accelerant is frequently found right inside your medicine cabinet. I'm talking about the very common, often life-saving medications that millions of us over 60 take every single day. For conditions like high blood pressure or type 2 diabetes, these medications are doing a critical job, but they can come with a significant side effect that directly impacts your bladder. Let me tell you about another patient, Brenda. She's a delightful 72-year-old grandmother who came to me, convinced she was developing a serious bladder problem. The urgency was unbearable, and she was mapping out bathrooms everywhere she went. When we reviewed her medications, one stood out immediately: a diuretic, often called a water pill, that she was taking for her blood pressure. These are fantastic medications. They work by encouraging your kidneys to remove more salt and water from your body, which lowers the volume of blood in your vessels and, in turn, lowers your blood pressure. But in doing so, they dramatically increase the amount of urine your kidneys produce. Brenda's prescription simply said take once daily. So, to make sure she didn't forget, she was taking it with her dinner every evening. Can you see the problem here? She was essentially flipping the on switch for maximum urine production right before going to bed. It was a simple scheduling issue with profound consequences for her quality of life. By taking a powerful diuretic in the evening, Brenda was setting herself up for a restless, fragmented night every single night. The solution, thankfully, was remarkably simple. I did not tell her to stop taking her blood pressure medication. That would have been dangerous. Instead, we made one small adjustment. We moved her dose from dinner time to breakfast. The impact was nothing short of dramatic. Within 2 days, she was sleeping for 4-hour stretches, and within a week, she had nights where she only woke up once. The medication was still doing its vital job of protecting her heart, but we had shifted its main side effect to a time of day when it was merely a minor inconvenience, rather than a nightly torment. Brenda's story is a perfect example of why these conversations are so important. It's not just diuretics either. A newer and very effective class of medications for type 2 diabetes, known as SGLT2 inhibitors, you might know them by brand names like Jardiance, Farxiga, or Invokana, work in a similar way. They lower blood sugar by causing your kidneys to expel excess sugar directly into your urine. It's a fantastic mechanism for controlling diabetes, but sugar molecules naturally pull water along with them, a process we call osmotic diuresis. So, these medications also significantly increase urination. If you're taking one of these in the evening, you could be unknowingly contributing to your own nocturia. So, here's your first practical assignment from me today. Sometime later, I want you to take out your medications or your medication list. Read the names. Are you taking a diuretic like furosemide, hydrochlorothiazide, or spironolactone? Are you on one of those diabetes medications I just mentioned? Now, look at the time of day you take them. If you are taking them with dinner or before bed, you may have just uncovered a major clue. Now, I must be absolutely clear on this next point. Do not stop or change the timing of any prescription medication on your own. This is a decision that must be made with your doctor or pharmacist. But you have now become an empowered, informed partner in your own healthcare. You can go to your doctor not just with a complaint, but with a potential solution. A simple question: doctor, I'm waking up constantly at night, and I noticed I'm taking my water pill at 6 p.m. Could we discuss moving it to the morning? can be the single most important sentence you say for improving your sleep and quality of life. Now, we've discussed the natural aging of the kidneys and the powerful impact of medications. But the story doesn't end there. Sometimes, the issue isn't about how much urine is being produced, but rather about the plumbing itself. And this is where we often see significant differences between men and women. For many men over 60, urinary frequency has less to do with the kidneys and everything to do with a small, walnut-sized gland that sits right below the bladder, the prostate. Continue. This is where I need your undivided attention. What we are about to discuss moves beyond lifestyle issues and into the realm of clear, undeniable warning signs. These are symptoms that, when accompanying frequent urination, should prompt an immediate call to your doctor's office. Please do not explain these away. Do not wait for them to get better on their own. These are your body's fire alarms, and we must heed the call. The first red flag is pain or a burning sensation when you urinate. This is the classic sign of a urinary tract infection, or UTI. While many people think of UTI as a simple nuisance, in older adults, they can be far more serious. An untreated infection in the bladder can easily travel upward into the kidneys, causing a much more severe illness called pyelonephritis, which can lead to high fever, back pain, and even sepsis, a life-threatening infection of the bloodstream. It's also critical to know that for seniors, sometimes the primary sign of a UTI isn't pain at all, but a sudden onset of confusion, agitation, or delirium. If you or a loved one experiences a sudden, unexplained change in mental state, a UTI should be one of the very first things a doctor checks for. The second red flag is one you can see with your own eyes: foamy, frothy, or bubbly urine. I'm not talking about a few bubbles that dissipate quickly. I mean a persistent foam that looks like the head on a glass of beer. This is often a visual sign of protein in the urine, a condition called proteinuria. Let's go back to our analogy of the kidney as a high-tech filter. A healthy kidney filter is designed to keep large, valuable molecules, like protein, in the blood while filtering out waste. When the filters are damaged by conditions like high blood pressure or diabetes, the holes become larger, allowing protein to leak through. Seeing foam in the toilet is like seeing coffee grounds in your coffee cup. It tells you the filter is failing. This is one of the most significant and earliest detectable signs of chronic kidney disease, CKD. The third red flag is new or worsening swelling, what we call edema, in your ankles, feet, or legs. You might notice your socks leaving deep indentations at the end of the day, or that your shoes feel unusually tight. When your kidneys are struggling, they lose their ability to effectively remove excess salt and fluid from your body. Gravity pulls this extra fluid down into your lower extremities, causing them to swell. If you can press your thumb into the swollen area and it leaves a pit or an indentation for a few seconds, that's a classic sign of this fluid buildup. This is not only a signal of kidney distress, but also puts a tremendous strain on your entire cardiovascular system, especially your heart. Let me tell you about Frank, a 75-year-old retired mechanic. He noticed his ankles were so puffy his shoes barely fit, but he figured it was just from standing in his garage workshop. His wife, however, noticed that the water in the toilet bowl looked soapy after he used it. She was the one who put the two clues together, the swollen ankles and the foamy urine, and insisted he call me. Frank was right to be concerned. His tests confirmed stage 3 chronic kidney disease. But here's the hopeful part of the story. Because he came in when he did, we were able to make immediate changes to his diet and medications that have slowed the progression of his disease to a crawl. That phone call didn't just get him a diagnosis. It fundamentally changed the course of his future health. It gave him back years of quality time. I know that the last section was serious, and hearing about those red flags can be frightening. But I want to shift our focus now from the problems to the solutions. Fear is not a good long-term motivator, but empowerment is. The most important step you can take is to have a conversation with your healthcare provider. But while you are waiting for that appointment, there are powerful, practical, and effective steps you can begin taking this very day to help manage your symptoms and regain a sense of control. These are not cures, but they can dramatically improve your quality of life. First, let's talk about how to drink, which is often more important than how much you drink. The natural instinct for someone running to the bathroom is to simply stop drinking water. This is a big mistake. When you become dehydrated, your urine becomes highly concentrated. This concentrated, dark yellow urine is full of waste products that can act as a potent irritant to the delicate lining of your bladder. This irritation can paradoxically trigger even more feelings of urgency and frequency. The key is not to drink less, but to drink smarter. I call it strategic hydration. Aim to drink a steady amount of water throughout the morning and early afternoon. Then, and this is the crucial part, establish a fluid curfew. About 2 to 3 hours before your planned bedtime, stop drinking all liquids. This includes water, tea, milk, juice, and even foods that have a high water content, like soup or melon. The simple act gives your body the time it needs to process those fluids, and for you to empty your bladder before you lie down for the night. Second, we need to become detectives about what we are putting into our bodies. Just as some foods can irritate a sensitive stomach, other foods and drinks can directly irritate the bladder, making it feel overactive. The biggest culprits are often our daily rituals. Caffeine is a major one. It's a diuretic that makes you produce more urine, and a bladder stimulant that increases urgency. This isn't just in coffee, but also in many teas, sodas, and even chocolate. Alcohol is a double whammy. It's also a diuretic and an irritant. Other common triggers include artificial sweeteners, spicy foods, and highly acidic foods like tomatoes and citrus fruits. I had a patient, Margaret, who was suffering from terrible daytime urgency. She couldn't figure it out. I suggested she keep a simple bladder diary for 1 week. She just jotted down everything she ate and drank, and made a note of when her symptoms were at their worst. The culprit was a surprise to her. It was the large glass of healthy orange juice she was having with her breakfast every single morning. The high acid content was irritating her bladder for hours afterward. By simply switching to a less acidic fruit, her morning urgency improved by 70%. I encourage you to try this. For just a few days, track your intake and your symptoms. You may uncover a simple dietary trigger that, once removed, can bring you immense relief. This isn't about deprivation, it's about information. It's about discovering your personal triggers and taking back control, one smart choice at a time. Beyond what you eat and drink, we can also use specific behavioral techniques to help retrain your bladder and ensure you're emptying it more effectively. These methods cost nothing, have no side effects, and can be remarkably effective. The first technique is called bladder retraining, which starts with something called timed voiding. Right now, your bladder is in charge. It sends a signal, and you run. This pattern can actually train your bladder to become overly sensitive, signaling an urge long before it's truly full. Timed voiding flips the script. It puts you back in the driver's seat. Here's how you start. Instead of waiting for the urge to strike, you go to the bathroom on a fixed schedule. Pick an interval you know you can manage, say, every 90 minutes during the day. Go at that time, whether you feel a strong urge or not. The goal is to empty your bladder before it gets to that point of desperate urgency. Once you're comfortable with that schedule for several days, you can try to slowly extend the interval by 15 minutes. This process gently and gradually stretches the bladder, increasing its capacity and teaching it to hold more urine before sending that urgent signal. It requires patience, but it is a proven way to reduce frequency over time. Next is a simple but profoundly effective trick, especially for men dealing with BPH, but it can be helpful for women as well. It's called the double void. As we've discussed, incomplete emptying is a major cause of frequent urination. You think you're finished, but a significant amount of urine is left behind, shortening the time until your next trip. To perform a double void after you finish urinating, don't immediately get up. Simply stay seated, relax for about 30 to 60 seconds, take a few deep breaths, and then lean forward slightly and try to urinate again. Many people are astonished to find that a second stream is produced, sometimes a substantial amount. This simple habit helps ensure your bladder is as empty as possible, buying you more precious time and peace of mind. Finally, let's revisit the issue of swelling in the legs and its direct link to nighttime urination. If you're someone who has puffy ankles at the end of the day, this tip is for you. During the day, while you are standing and walking, Gravity causes fluid to pool in your lower legs. When you lie down flat in bed, all of that accumulated fluid gets reabsorbed into your bloodstream and sent to your kidneys for processing. This creates a surge in urine production precisely when you want it least. The solution is to manage that fluid before you go to bed. For an hour or two in the evening, while you're reading a book or watching television, elevate your legs. Prop them up on some pillows or use a recliner to get your feet to at least the level of your heart, or slightly above. This allows that fluid to be reabsorbed and processed by your kidneys early in the evening, so you can empty your bladder before you turn in for the night, rather than having your kidneys do all that work at 2 a.m. These are all powerful strategies you can implement on your own. They are tools to put in your health toolkit. But remember, these are meant to complement, not replace, a conversation with your doctor. They are pieces of the puzzle. The final, and most important, step is to take all this information and use it to become the most powerful advocate for your own health. We've covered a great deal of ground together today, and I want to take a moment to bring it all together. We started with a simple, frustrating problem, a life interrupted by constant trips to the bathroom. My goal was to help you see that this is not a symptom to be ignored or simply endured as an inevitable part of aging. It is a conversation, and it's time for us to learn the language. We've learned that the cause can be a complex interplay of factors: the natural, gradual changes in our kidneys and hormones, the unintended side effects of necessary medications, and structural issues like an enlarged prostate or a weakened pelvic floor. We have armed you with knowledge, turning vague symptoms into specific clues. You now know to ask yourself pointed questions. Is it happening mostly at night? Did it start around the time you began a new medication? Is the stream weak? Is there swelling in your ankles? And most critically, we have drawn a clear line in the sand. You now know the undeniable red flags: the pain, the foam, the swelling that mean this is no longer a conversation, but an alarm, signaling the need for immediate medical attention. Catching kidney disease early, identifying a serious UTI, or addressing fluid retention doesn't just improve symptoms, it saves lives and preserves health for years to come. And then we moved into the most important phase: action. You now have a toolkit of practical strategies you can begin using tonight. You can start hydrating strategically. You can become a detective with a bladder diary. You can practice the double void. And you can elevate your legs to give your kidneys a head start on their nightly work. These actions are powerful because they put control back where it belongs, in your hands. But all of this knowledge, all of these strategies, leads to one final, essential step. You must take what you've learned and use it to advocate for yourself. You are the chief executive officer of your own health. Your doctor is your most trusted consultant, but you are the one in charge. Do not be embarrassed to discuss this. I promise you, your doctor has heard it all before, and they want to help you. A simple conversation, followed by a simple urine test and a basic blood panel, can unlock a world of information. It can provide you with a clear diagnosis, a targeted treatment plan, and most importantly, peace of mind. For the vast majority of people, the solution is within reach. It might be as simple as changing the time you take a pill, starting some targeted exercises, or getting a prescription to help relax your prostate or bladder. You do not have to accept a life of broken sleep, constant anxiety, and canceled plans. Your health in your 60s, 70s, and far beyond can and should be vibrant, active, and full of freedom. This is not just about living longer, but about living well. So please, take this information to heart. Make that appointment. Start that conversation. You are worth the effort. Thank you for spending this time with me. Take that first step today.